Hi everyone, welcome back to Fit with Shraddha. So today's topic is about non-alcoholic fatty liver disease. Now non-alcoholic fatty liver disease is becoming very common. Almost 25% of the world's population is getting affected with it. So it's becoming a growing concern and it is very important to know about non-alcoholic fatty liver. So in today's video, we are going to see the causes, risk factors, then the symptoms associated. Also we are going to see the management, treatment, some symptoms of non-alcoholic fatty liver, and also more importantly we will be seeing how can we prevent this condition. Now first of all, what is a fatty liver? Now the term itself explains that whenever there is excess accumulation of fat in the liver cells, it is called as a fatty liver. Now little bit of fat in the liver is not at all a concern, it is not an issue, but the problem arises when fat accumulates more than 5 to 10% of the liver's weight. Now a small amount of fat in the liver is not harmful, but when the fat exceeds or it becomes greater than 5 to 10% of your liver's weight, then it is problematic. Basically there are two types of fatty liver. One is non-alcoholic and the other one is alcoholic fatty liver. So non-alcoholic fatty liver is mostly seen in people who drink very little alcohol or absolutely no alcohol. Whereas alcoholic fatty liver is seen amongst people who have a heavy alcohol consumption. So an alcoholic fatty liver is seen amongst people who consume alcohol more frequently and their consumption is very heavy. So today let us understand about non-alcoholic fatty liver in detail. Now non-alcoholic fatty liver is primarily to do with an unhealthy lifestyle. If you have a very poor diet and there is lack of physical activity, it leads to this condition. So let us understand the causes and risk factors. Number one is obesity. Now excess body fat, especially around the abdominal area, is one of the major reasons of a non-alcoholic fatty liver. Second reason is type 2 diabetes. This is because of insulin resistance which occurs in this condition. Third is dyslipidemia. Dyslipidemia is wherein you have high triglyceride levels and you have low good cholesterol or HDL. Both these conditions, high triglycerides and low good cholesterol, leads to accumulation of fat in the liver. Fourth is metabolic syndrome. Now metabolic syndrome means that if you have a cluster of symptoms occurring together, this means that if you have hypertension, that is you have high BP, you have high blood sugar, you have high cholesterol. Now all of these things, if they are occurring simultaneously inside your body, then you are more exposed to the risk of a fatty liver. Number 5 is rapid weight loss. Yeah, surprisingly, this is one of the reasons. This is because whenever you do some extreme diet and there is lot of weight loss in a short period of time, it leads to a buildup of fat in the liver. Sixth reason is genetics. Now, although sometimes you may be having a healthy lifestyle, you may be having a good diet, a good exercise regime, but it is also found that such people are detected with a fatty liver. Now this has got to do with genetics. So if there are certain gene variations, it exposes you to the risk of developing this condition. Now most people with a non-alcoholic fatty liver are asymptomatic. There are no direct symptoms which indicate the presence of this condition. So some of the symptoms include like you have fatigue, then you have pain in the upper right section of your abdomen. In severe cases it can lead to jaundice, and there is also unexplained weight loss. Now abdominal discomfort becomes sometimes the most obvious symptom, especially on the upper right side of your abdomen. So how do you diagnose a fatty liver? Now there are certain blood tests which will help you to detect a fatty liver. They will show the presence of elevated liver enzymes. Other tests include your CT scan, your ultrasound, MRI, and in more severe cases a liver biopsy can be done. Now a biopsy is done in order to confirm the extent of the liver damage caused. So how do you manage and treat a non-alcoholic fatty liver? Now there is no specific medication for this condition, but it is only lifestyle changes that will help you to manage this condition. And if you do these changes early on, in the early stages, you can potentially even reverse the condition. Now number 1 is weight loss. So it is found out by research that 5 to 10% of weight loss will reduce the inflammation in the liver. It will also reduce the fat deposits. Now this can be achieved through a good well-balanced diet, reducing intake of junk, processed food, eating more healthier and wholesome options. Also minimizing your intake of refined carbohydrates, sugar and saturated fats is also important. Now regular physical activity and exercise also improves this condition. So include cardio, include strength training into your exercise regime. So any form of exercise, walking, cycling, resistance training, swimming, or exercises which improve your flexibility, balance, like yoga, all of this combination of these different exercises will help you to burn fat and also bring down the inflammation. Losing weight will also improve your insulin sensitivity, and this is directly going to affect your fatty liver condition. Second is control of blood sugar and cholesterol. Now, if you are having diabetes or dyslipidemia, wherein you have abnormal levels of triglycerides, LDL is very high, and your good cholesterol or HDL is very low, managing these conditions through proper medication and lifestyle changes will help prevent further liver damage. Number 3 is avoiding alcohol and certain medications. Now, although non-alcoholic fatty liver is not caused due to alcohol, but consuming even little amount of alcohol also worsens the symptoms. So it is better to avoid alcohol completely, or at least regulate your intake. Now, some medicines are known to put a strain on the liver. So it is always better to check with your doctor to avoid medicines which can put a strain on your liver. Number 4 is monitoring and regular checkups. So if you are diagnosed with non-alcoholic fatty liver, periodically get your liver function test done. Go to your doctor, check whether you need any medications. It is important to monitor this condition to prevent further worsening. Now, this was all about management and treatment, but the best thing is that you take precautions well in advance to prevent this condition in the first place. So preventing non-alcoholic fatty liver disease involves adopting healthy lifestyle changes. Number 1 is to maintain a healthy weight. So you have to always see to it that you do not gain weight through proper diet, exercise, and lifestyle changes. Secondly is exercising regularly. Now, you may be managing your weight with the help of diet, but exercise is also very essential. At least 150 minutes of moderate intensity exercise per week is mandatory. Number 3 is to limit your fructose intake. Excessive consumption of fructose has been correlated with accumulation of fat in the liver. Fructose is mainly found in processed foods, sugar drinks, which contain a lot of sugar. Now, whenever you purchase any product, check the ingredient label. Now, if it contains high fructose corn syrup, do not consume that product. Now, excessive consumption of high fructose corn syrup is associated with many metabolic disorders, and non-alcoholic fatty liver is one of them. Now, non-alcoholic fatty liver is a silent, yet it is a serious condition. The problem with it is that most of the symptoms are asymptomatic. You will not know unless you actually go and check your liver, or you come to know certain really obvious symptoms. But always know that it is always preventable, and it can also be reversed through the right lifestyle changes. Non-alcoholic fatty liver is closely related to obesity. So it is very important that you keep a check on your weight and address the root causes, like maintaining a good diet, exercising regularly, keeping your stress levels in check. So if you make the right lifestyle changes, you can potentially reduce the risk of non-alcoholic fatty liver and improve your overall liver health. I hope today's video was helpful to you. So if you have any queries, please put it down in the comment section. Do not forget to like, share and subscribe to my channel. Until the next video, take good care of yourself. Bye-bye.